Let's focus on training, which is the key component of quick straight teeth. What does your training offer dentists?
Great question. I love teaching first and foremost. I guess it's in my genes. My father was a teacher, my brother and my sister were teachers as well. Throughout my own development and training, we've always been encouraged to give back. So one of my mentors used to say to me, in fact he was a maxillofacial surgeon, was you see one, you do one, and then you teach one. And I take that philosophy based on my experience, and I like to give back, because once upon a time I was also sat in practice as a general dentist doing a range of procedures, and it was only when I started simple orthodontic cases, because I had good mentors and trainers who stimulated my interest in the subject, that I actually went on to specialise as an orthodontist. And so I feel it's very, very important for the future of our profession as dentists, and also for the subspecialty of orthodontics, that we encourage and provide that impetus and enthusiasm for our younger colleagues, and hopefully stimulate some of them to do more orthodontics. And certainly we're very lucky today that we've had a few of our colleagues who've gone on to do specialist training in the UK, and I hope that will be the same wherever we go with QST. The reason why I think it's taken off so well is because, unlike a lot of the other systems, we always have from day one stressed that good teaching, which involves good assessment, diagnosis, treatment planning, case selection, and using good quality products, all actually being backed by scientific evidence in the literature and based on years and years of experience from your mentors who use these products day in, day out. I run several practices and I've tried a whole plethora of materials, and we know what works in terms of clinical procedures, but also which materials are best. And I think it's really important to be truthful and honest to our colleagues, what is good and what is bad based on our level of expertise, and I hope that comes across, and certainly that's the feedback that we get, so that encourages to do more and strive to improve our service to our colleagues.
As a UK specialist in orthodontics, why did you choose to train GPs when the politics surrounding this area of dentistry is so rocky?
Yeah, so not surprisingly, some of my colleagues ask a similar question, as why are you teaching general dentists? Surely they are our competition. Well, I always look at my list of qualifications, and the first three letters, BDS, Bachelor of Dental Surgery, that is what I graduated as, and that is what I will always be. I have moved on to become a specialist, but I always and will be involved in general dentistry. I still carry out some general dental procedures, which I love to do, and I love to attend non-orthodontic lectures and see all the developments within our great profession. So I think it's only right that in a time when adult orthodontics, cosmetic treatments are becoming more and more popular as we gain more control of dental disease and people keep their teeth for longer, it's only right that if they want their teeth to look better, that orthodontics should be a part of that. We're moving towards an era of minimally invasive dentistry, and treatment should be more conservative, and that's only right as well. And I would always encourage our colleagues to do the same. I like to apply the daughter test to my own family, or whenever I'm treating any patients. What would I do if this was my daughter or my family member? Would I want them to have invasive dentistry when a far more conservative method is available? And would I say, well, in actual fact, it's only one type of professional who is capable of doing this type of treatment, even if the case looks extremely simple? Well, no, I think it's in the remit of every single dentist. We're taught orthodontics at undergraduate level, and simple is simple. So just like as a general dentist, I could undertake simple extractions and refer the more complex cases to my oral surgery colleagues, I think it's only right that our general dental colleagues should be able to undertake simple orthodontic treatment after they've received good quality training. And yes, there will always be a place for specialist orthodontists to tackle the more complex cases. And certainly in my own day-to-day practice, I like to get stuck into the really meaty, challenging orthodontic cases, because that's what my specialist training enabled me to do, and that's quite rightly what I should be doing. And I could and should be charging appropriately for those types of cases. So when colleagues say to me that by you teaching general dentists, you're actually reducing our share of patients, I think that's false, because in actual fact, the more that we all talk about orthodontics, and a lot of it is out of our control because the big companies in this world are doing this anyway, our share of the pie is not getting smaller because the whole pie is getting bigger. And so we will all be busier and busier. And certainly my own area, where I've set up a practice, my latest practice in a very, very competitive area of orthodontics, I've found that mentoring and helping my local colleagues actually increases our goodwill, and the number of referrals that I have in turn of the complex cases has increased. So communicating with our colleagues is extremely, extremely important.
What makes QST's offering so unique in this crowded marketplace?
Yeah, so QST from day one has been specialist led, taught, designed and supported, and that remains the case. In the early days when we looked at the marketplace, many of the orthodontic systems for general dentists were taught by general dentists who had varying degrees of experience. Some who are fantastic colleagues who've had many years in the profession practicing orthodontics, albeit without specialist qualification, but who are great clinicians and teachers. But some who, rather worryingly, had only completed a handful of cases and were therefore teaching orthodontics from the point of view of somebody with very limited experience, which I think is always dangerous. You would like your teacher, your mentor, to have vast experience and preferably the gold standard level of training. Certainly I would when I attend a course. I like to look at the credentials and experience of whoever is advocating anything to me, backed up by my own intelligent and intellectual appraisal of what they're saying. And so I think that really speaks volumes. We can speak naturally about the subject as specialists because we do this day in, day out. I've been doing this for over 15 years and over 10 years as a specialist. I believe that I have the experience in setting up practices, in being in the position of my general dental colleagues. I don't forget that I was a general dentist for 8 years as well, alongside and overlapping my orthodontic training. And I still like to carry that out. So hopefully we come across as being genuine and being natural. And nothing that we have to say when we teach is forced. It comes from experience, it comes from the heart. And at the end of the day, I'm very much a practicing clinician, so whatever I teach to my colleagues has a consequence back to me as a clinician every day. I have my name behind the QST brand, and so therefore I think it's extremely important that I'm genuine. Whatever I teach works, and the results that we obtain are good quality results, long-lasting results. And at the end of the day, we have happy patients, we have happy colleagues, and here at QST, we're very, very fortunate that the team is very like-minded. We call ourselves a QST family. There are no big egos floating around. In fact, everybody has a genuine passion for teaching, and I think that comes across in the feedback that we get. And so that's a big part of it. And underpinning all of that, I think, is the support that we give. We have a forum, we make ourselves available. Certainly we like to provide responses to any sort of question within 24 hours. The quality of our products is far superior because, once again, we only supply products that we use in our own practices on our own patients, backed by evidence and literature and scientific research, and realistically price those components as well. And I think that's very, very important. There are some vastly inferior products on the market being provided and sold to our general dentists for really what are crazy prices compared to what they're actually getting. With regards to the clear aligner companies, there is a huge drive and push in technology with clear aligner therapy. From day one, we've always provided clear aligners and fixed braces, and also hybrid type of removable appliances. So the whole range, we don't limit ourselves. But I believe that the fixed appliances are still the workhorse. I do a huge number of clear aligner cases, but I actually do more fixed braces than clear aligner cases. And I think most specialists still do that because the fixed brace will always be the workhorse. But also it's very important to understand that clear aligners, in themselves are not magic. You need to know the biomechanics of orthodontics to actually achieve good results, even with clear aligners. And there's nothing like a fixed appliance that can give you that understanding of biomechanics to move teeth. And I regard clear aligners and attachments as being wires and brackets. They're just in a different package. At the end of the day, a force moves the tooth, whether that be plastic or whether that be metal. And so being proficient and better in your fixed appliance treatment and knowledge of fixed appliances will only make your clear aligner treatments better as well.
Why is it important for GPs to provide orthodontics, given that they have managed so many years without offering braces? What's changed?
Well, first and foremost, I think there has been a huge paradigm shift in dentistry from treatment of disease to treatment of cosmetics. Certainly when I qualified almost 20 years ago, it was still very much focused on treatment of dental disease, caries and periodontal disease, and there wasn't really much taught at undergraduate level about aesthetic and cosmetic dentistry. Now I understand that is exactly the same at undergraduate level because I am a university lecturer and I teach undergraduates, but then today in practice we find our patients actually asking for more cosmetic aesthetic treatments, and that is definitely related to the rise of celebrity culture, social media, Instagram and Facebook. And so we're constantly bombarded by imagery these days of a perfect set of teeth, white teeth, but also very perfectly aligned teeth. Now, even 10 years ago, aesthetic and cosmetic dentistry was very much focused on porcelain restorations, which was quite destructive. And patients are well informed these days as well, and certainly many patients don't want the destructive porcelain type of restoration, and they're also aware that they can have teeth aligned relatively quickly, particularly the teeth that are actually on display, and can have more aesthetic conservative treatments such as composite bonding. And the improvement in materials, technology, factors such as smile design, and therefore and leading on from that, our patients actually going away happy and telling their friends and showing on social media what is possible, has driven this move towards more aesthetic dentistry, which is aligning the teeth, brightening the smile with whitening products, and using more conservative restorative methods as well. So positioning the teeth properly is fundamental. There's huge marketing campaigns from the large aligner companies and orthodontic companies, and this is well within the capability of most dentists to improve a smile and be part of that smile design. So there'll always be a place for specialists, but there are also a huge number of simple cases out there which we don't often see as specialists unless sat in general dental practice. So it is an essential part of everybody's remit as a general dentist. And even for those cases that are referred, a knowledge of how teeth are aligned, I think, is fundamental these days for any general dentist.
Why should GPs choose to go with QST? What will they learn in these courses?
Wow, great question. Hopefully all our colleagues come with an open mind, and they should be going away learning the fundamentals of a proper orthodontic assessment, diagnosis, case selection, and also the ability to start simple cases in a logical stepwise manner. So they won't come on our course and learn comprehensive orthodontics because that's impossible to teach in a few days and support online, but they will learn and be drip fed cases suitable to their level of experience. So hopefully to also demystify the aspect of orthodontics or the subject of orthodontics, which often at undergraduate level is taught very quickly, not understood greatly, but hopefully they will leave our courses with a better understanding and actually the physical and tactile experience of having manipulated and used all the products, appliances that they will be using on a day-to-day basis, and put together in simple terms, but always underpinning the best available science and research and evidence as well. So there's nothing magical or wacky that we teach in our cases. It's all fully established science based on undergraduate level orthodontic treatment, and the remit being treatment of simple cases. So hopefully to give our colleagues the confidence to utilize skills straight away from day one when they return to their practice, and look at the cases, the huge number of simple cases out there that are ready to be treated. And that's our aim, is to instill that confidence, that experience, but also to support them and handhold them day by day after they leave, so that they're never left alone or feel alone.
Can you touch on your presence in the UK?
Yes, of course. QST is the largest indirect bonding orthodontic company in the UK. We have been for some time. We've trained the greatest number of dentists in the UK by quite a way, and we also have the largest number of colleagues on our courses as well. We run 1 to 2 courses per month and growing, and most of these are our dental colleagues who come from referral and word of mouth recommendation. Our team therefore has grown in terms of our specialist trainers to cope with the demand, which is coupled and linked to the demand in orthodontic treatment from the general public. We have reached across into foreign markets, both locally within Europe and also further afield in places like India and China, where we hope to be later in the year, but also Australia, where we've been for the last 4 years. We've trained over 4,000 dental colleagues in our Tier 1 level QST courses, and we have at any one time more than 2,000 active users. And some of our colleagues have since emigrated and come over to Australia, for example. And in this day and age, where most dental colleagues also meet online from various countries, news spread quite quickly to Australia. As I said, some of our colleagues moved over here who had done QST and wanted to continue doing QST cases here in Australia. And likewise, many of our colleagues had heard of us from the UK, and so there was a demand. And so every year upon year, we have more and more Australian colleagues who attend our courses, who like the system, like the support. Our support being online doesn't have any national geographic boundaries, and in actual fact, for this side of the world, it works fantastically well, because you post a case, we provide a response, and it's there for you in the morning. And so the time zones can actually work to your advantage. We provide responses within 24 hours anyway, but you might find they're a little bit quicker over here. And that really has worked amazingly well for us. And you only need to have a look at the dental press and social media for our QST cases being advertised by patients and our dentists alike. So that's going from strength to strength.
What support do you have in Australia? What can the dentist rely on?
Yeah, I think it's fantastic that we have local support in every region that we are, and also in Australia. It's very important that you have the assurance that somebody local who understands your situation, the way that dentistry works in your country and your locality, is fully understood, and therefore any questions that you may have, any support that you may need, comes from a local level. And we aim to do that wherever we are. So I'm very, very fortunate to have Stephen Douglas, who many of you have already met or will meet, who's a fantastic guy. There's nothing, no question too small, and nothing too small that he can't do to help you out as well. And Steve really has coordinated the effort in Australia. He's been sort of fundamental to us growing our Australian team. So now we have locally based QST trainers, teachers, mentors, who are also available to support you on a one-to-one basis should you need that. All the products, materials, courses are designed but also organized in a way to suit the Australian market, to support the busy Australian dentist. And so our remit, wherever we are, has always been on support and guidance. And no question being too small, no question being too silly, not at all. We'd rather know about it and help you. We have the experience, and many of our dentists ask a question that other dentists will also be wanting to ask, or information that they'd like to know. So we aim to provide support and guidance that helps absolutely everybody, but we're not too big that we can't provide bespoke support for you as a dental colleague. So all we ask is don't be shy. We're here to help. We love to help, and in fact, hopefully our colleagues who've been through our course will provide you with those testimonials as well. So that's why we keep having our colleagues coming back for more in terms of our more advanced courses as well, and that's very, very reassuring. As a company, we lose hardly any, if any, dental colleagues because we are the QST family, and that's the support structure that we aim to provide you.